Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest where we talk about healthcare issues, events, programs, services that are going on that I think will be of interest to you and your family. So I hope you'll stay tuned because I've got an exciting guest on the program. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Katie Brown. She is a doctor of audiology here at KRMC. Thanks for being on the program, Katie.
Thank you for having me. It's a pleasure to be here.
Well, and we are so blessed to have an audiologist on staff. That's awesome, because that was something, of course, we didn't have for years. And in case people don't know, let's start by saying, what is an audiologist? What do you do?
An audiologist is a specialist who evaluates hearing and can prescribe hearing aids, and can also recommend things to help improve hearing that are not hearing aids. We also, in the field of audiology, work in prevention, so hearing loss prevention in places that have employees that work in lots of noise.
Okay, so you can go out to the workforce maybe and help identify areas that have got high.
Exactly, measure noise levels and then prescribe hearing protection for people that are in those environments on a day-to-day basis. And then we can also evaluate disorders of the vestibular system, which is the balance part of the inner ear, to determine if that could be why someone may be experiencing dizziness or balance problems. And then I will make recommendations for follow-up. And and then also seeing pediatric populations. Lots of children have hearing loss due to middle ear issues like ear infections, and some children have permanent hearing losses. And so it's a full breadth of diagnostic and treatment for young to old for hearing loss and balance and dizziness.
Well, I think a lot of times people just think of hearing aids for older, for seniors. Of course, I'm getting closer myself, so I have to be careful when I say that. But the fact that I think in our youth, at least, that was the case more. Maybe that it wasn't necessarily diagnosed until people got older.
Over the past 10, 15 years, there has been a lot more move to diagnosing and treating hearing loss in young children, even infants. So some infants are born with permanent hearing losses. And with the universal newborn hearing screenings that hospitals are required to do now, we're identifying even newborns who have hearing loss and then fitting them with amplification a lot sooner. But hearing loss is definitely not something just for
the
old, older
folks.
Individuals.
Well, I'm curious now, how do you test a newborn to know if they've got hearing loss or not?
That's a good question. So there are a couple different tests that we're able to do that do not require an actual behavioral response.
Okay.
So in most neonates, what we do, two different tests. We do an auditory brainstem response test. It's called ABR.
Okay.
And that's where we insert earphones in the baby's ears, and then we put little electrodes, they're little metal discs, on the ears and on the forehead. And then we stimulate the ear with sound.
Okay.
And we measure the neural impulses on the nerve from the ear to the brain stem to determine if the ear is sending that response to the brain. And then there's another test that we do that measures a response from the little hair cells in the ear that we should see this response in a normal ear. So,
Okay.
And that's called otoacoustic emission. So another long word, but those are two main tests that that are used in universal newborn hearing screening or in diagnosing a hearing loss in neonates.
Wow, I had no idea. And so if your testing does show that the baby has some hearing loss, then how young or how old do they have to be before you would fit them with hearing devices?
I think you can fit a very small baby with
Really?
hearing aids. You just want to get accurate thresholds, so meaning that knowing exactly what the hearing loss is, so you're not over amplifying or under amplifying them with hearing aids. But you can fit hearing aids on newborn babies. The goal is, I think, in newborn identification is to fit them by 6 months of age with hearing aids.
Okay. Well, that makes sense because obviously if they're not hearing, that really impacts a lot of their development.
Absolutely, yeah.
Speaking and all of that.
Yep, so speech development can suffer if a child has
Sure.
a hearing loss. And so that's not just a concern for children with permanent hearing loss, but even those with middle ear fluid, recurrent ear infections, and things like that.
Right. So that's another thing probably important for parents to know, that if their children have chronic ear infections, things like that it's not just a matter of getting rid of that infection, but maybe double checking to have that tested to be sure it hasn't affected.
Absolutely. Well, in many cases, middle ear infections won't cause a permanent hearing loss.
Okay.
But if it's a chronic condition, it's something that you do want to have evaluated, because
Yeah.
if your child always has fluid in their ears, they're not going to be hearing normally, and that can impact their school performance and their speech
Sure.
development.
Wow. Yeah, and that's, again, it's very important, both their vision and hearing impact how they learn.
Absolutely.
And, I think so often, so many kids, you hear the stories of they weren't diagnosed till way late, and their whole years of school they struggled and felt stupid or whatever, and here it wasn't really them, it's just they weren't hearing or seeing
Absolutely.
what was being shown. So,
Yeah,
and
so
how
it's really
sad.
important to get intervention as soon
Okay.
as a problem is diagnosed, and to watch out for the warning signs.
And I was just going to ask you, how does a parent know? What do they watch for? I mean,
Yeah.
I guess in the older folks, what'd
Yeah.
you say?
Yeah.
You expect that. But
Well,
what
some
about-
of the same things in children, but just seeing how they respond to sound. So if you call their name and they're not turning to you, or if they don't seem to enjoy music or auditory stimuli, if they need the television louder than is comfortable for everybody else in the family. If in young kiddos, if they pull on their ears, or if they're not startling to loud sound, those can be indications that there could be a problem.
Okay.
And some kids just don't care about sound. So, I
Right.
mean, that doesn't mean that they have a hearing loss, but it just
Sure.
means that it's something that's worth looking into a little bit further.
Well, you remind me of the story of my oldest son when he was like 3 and 4 years old. I actually took him to the pediatrician to have his hearing tested because I swore he was having hearing issues, and the doctor checked him and did some tests. Of course, we're talking a few years ago now, but he was like, no, his hearing's just fine. He has what we call selective hearing. He is choosing not to hear you and listen to you.
Yeah.
Still to this day, that condition continues. And I'm sure he'll watch this show, so he'll be calling me up going, Mom. So it is important, though, I think, that parents just be aware. And I think we've talked, too, in the past about other things that can cause hearing loss in children. So not just the middle ear infections, but listening too much to loud music, maybe with
Loud music
earbuds.
and loud sounds like firearms, and anything that can cause a noise-induced hearing loss in adults can cause a noise-induced
Sure.
hearing loss in children. And it's something to be cognizant of for parents, because if you bring your child out to the shooting range with you, they should have hearing protection on. Everybody
Yes,
should have hearing
everybody
protection
should.
on, including the child.
Yeah.
Because noise-induced hearing loss in most cases is a permanent thing, and you definitely don't want a child to have to deal with the effects of noise-induced hearing loss.
For the rest of their life, just because of one forgetting
Yeah.
or not thinking. And, it's like you said, sometimes people probably think, well, I'm the one shooting the gun. They don't realize folks standing around them are having that repercussion as well.
Yeah,
I mean, you
absolutely.
see that, I know, a lot in the military, too, that if they, aren't wearing the correct hearing protection and thereby ammunition going off.
Yep, yeah, I've seen a lot of soldiers and airmen who have hearing losses that look to be noise induced based on their military noise exposure.
So there's obviously a lot of careers that can be could lead to hearing loss besides military. I think I have a friend who was in the mining industry.
That's one thing that came to mind. Yep, and factories and construction. Lots of people who I've seen with hearing losses were semi-truck drivers who have just the engine noise all the time.
I wouldn't have thought of that one. That's interesting.
Yeah, so I mean, noise is everywhere.
Right.
And it's just important to be cognizant of what noise you're exposed to and to do what you need to protect your hearing.
So does it have to do with the decibel level, if you would, the volume?
With damage to the ears, it's what comes into play is the length of time you are exposed to the sound and how loud it is. So the louder the sound, the less time you can be exposed to it without it causing a permanent hearing loss.
So going to a rock concert and sitting up close by the speakers for a couple hours is not a good thing.
It's not a good thing, but in most cases that's not going to lead to a permanent hearing loss.
Okay. But if you were to, what about the folks that you see at the wellness center? They've got earbuds in and they've got their MP3 players going, and you can hear the music, even though they've got earbuds in, you can hear the music outside.
Yeah, that always scares me a little bit, and I would say that it might not be guaranteed that they will have a hearing loss from it, but it's probably good to bring down the level a little bit.
Just be aware of that it could.
The safe listening volume for an iPod is where the volume is halfway. Halfway from in between the top and the bottom of the volume is a safe listening volume for all day use.
Okay, very good. So now we talked about briefly, do you actually go out to some of our businesses here in Kingman to help them identify areas that are a risk for their employees?
Right now, I'm not a part of the screening process. So, so what the providers would be doing in that case is just the screening. But I am part of the process if what is called a permanent threshold shift. It's a big change in hearing that's documented on the screening happens. Then I may be asked to do a diagnostic hearing evaluation to see exactly the impact of the noise, what the hearing loss looks like,
what could have caused it,
and then what can we do to improve it.
Right. Now, you also mentioned earlier, you were talking about things to be done to improve hearing besides hearing aids. So did I hear that right?
You did.
What else?
So most of the time when I'm talking to someone about hearing aids, I also include information about strategies for effective communication. So it's not just about wearing hearing aids. Because there still are going to be situations that are difficult to communicate in. Some people don't want hearing aids, and some people don't need hearing aids, even though they still struggle with understanding people some of the time. And so some of those things are to make sure that you're looking at the person when you're talking to them, and that you're a good proximity from them, so that you're that their voice is projecting to your ears in an effective way. To make sure that you have a well-lit area. To turn down any background noise whenever possible, because talking in noise is always more complex than talking in quiet. And then lip reading whenever possible. So most people say, well, I can't lip read, but most people can do a little of it just intuitively without ever having learned. I was going to say probably do it without even realizing it. I was kind of watching your lips going, I can do it. No. And really the best benefit from hearing aids is when you couple hearing aids with lip reading. Well,
and I would bet that another stigma, if you would, that goes along with hearing loss is hearing aids, because I think a lot of people, especially my age, the baby boomers, remember our grandparents with the big old bulky thing in their shirt pocket that squealed all the time and made horrible, and it was like, I will never wear one of those. Things have come a long way since then, though.
Yes, things have come a long way, and I have a lot of patients in my clinic who actually have very positive experiences with hearing aids. Hearing aid technology has gotten a lot more sophisticated, so the whistle is a lot less likely now with the new technology. The devices are a lot smaller than ever before. Most of them you wouldn't even be able to tell someone's wearing.
I have a friend that I never knew that they were even wearing a hearing aid for the longest time. then one day I just saw that, just that little thing, and I was like, what is, oh my gosh, I never knew.
Yeah, so they're a lot more comfortable, a lot more comfortable acoustically and physically. They're a lot more discreet than ever before, and the technology is better than ever. So hearing quality, speech enhancement, noise reduction, feedback reduction is all better than it ever was
before. That's awesome. We're going to take a quick break, and then we'll come back and learn some more. We'll be back right after these messages, so don't go away.
But now there are actually hearing devices that are electronic that are able to amplify the surroundings.
Welcome back to Your Health Matters. My guest today is Dr. Katie Brown. She's a doctor of audiology here at KRMC. Thanks again for being on the show, Katie.
Thank you.
So we were talking, but before the break, we were talking about hearing aids and how different they are from what a lot of us baby boomers would remember our grandparents wearing. You were talking about how the changes that have been made, both in size, obviously the technology, everything we do now has got more technology than before. So what kind of, is that some of the things you see that stops people from getting hearing aids? Is there concerns about that?
I do see a lot of people who don't want anyone to be able to tell that they're wearing a hearing aid, and that's a definite justified feeling in some people, and so that's one of the reasons why a lot of people haven't gotten them. Some people don't think that they have a problem with their hearing.
It's just the spouse going,
yeah,
get your hearing checked.
Yeah, and sometimes people do associate hearing aids with aging, and that's something that they don't want the stigma for.
Yeah.
But a lot of people decide that they don't want to do it because of the cost. And you know, costs for hearing aids are there's a range of pricing. There are basic level hearing devices that will be, of course, a lot less expensive, and then there are premium levels of hearing devices and everything in between. And so usually we can find something that does fit within someone's budget if they are interested in improving their hearing. So so that is something that we try to accommodate for with every individual patient, to pick something that is both within their price range but is also going to be of benefit for their hearing.
Sure, right. It doesn't do any good to spend even a little bit of money if it wouldn't help.
Correct.
Right? So we'll make sure it's going to do the job. So if a person, wife or husband, is encouraging them to go get their hearing checked, or they're noticing it for themselves, do they have to go to their primary care physician first to get an appointment with you? How does that work?
It depends on the insurance. So for Medicare primary insurance, we do require a referral. Well, it's not us, it's Medicare requiring a referral.
Yeah.
But there are some insurances that don't require a referral. So if people can just check with their insurance. If they require a referral, then they do need to see their primary care doctor before we're able to see them.
But otherwise, they could call your office and you'd probably be able to give them an idea or know.
Correct.
And what is your number again?
Our direct line for our office is 928-681-8717.
Okay, 8717. And we'll bring that up again towards the end of the program, just to make sure people have time to write it down and get that covered. We were talking earlier, too, about the different things that can lead to hearing loss. And, of course, here in Kingman, we have a large hunting population. That's one of our big pastimes for a lot of folks. And I think hunters in the past have been maybe guilty of not always wearing hearing protection when they're
a problem
hunting.
With hunting is that you have to be able to hear your environment, so you can hear the animals, and so you can find what you're looking for.
Right.
But if you have earplugs in, traditionally you wouldn't be able to hear your environment, and you would be a lot less successful if you didn't wear hearing protection at all. So a lot of hunters that I have run into just didn't wear earplugs because it was too bothersome to what they're doing out there. But now there are actually hearing devices that are electronic that are able to amplify the surroundings, so that you're not missing those sounds, the small footsteps on fallen leaves or whatever, but that compress the gunshot so that it's not causing damage to your ears.
That's pretty cool. I didn't even know they could do that kind of thing.
Yeah, it's pretty cool stuff.
Yeah, that is amazing. So Do you think that that's something, even in the work environment, can they have things like that? I don't know. Maybe not yet, but
yeah, I would say that probably in the future, but right now the way the hearing protection works is just the really loud transient burst of sound. So in regard to persistent high levels of machine noise or things like that, they wouldn't function the same way for preventing those sounds from damaging the ears. But I'm sure that that technology will get there.
Yeah, probably just maybe.
Yeah, over time. Everything takes a little bit of time, but I do anticipate something like that in the future. One other consideration is that with those Hunter's headphones, they're super oral headphones, and a lot in the workplace, they want something that's in the ear that you don't have to, because it can be cumbersome depending on
probably, because they're having to wear safety hats as well, and so that could get in the way of the other safety equipment they're trying to do.
Yeah, possibly.
So do you work pretty closely like with our occupational health department then that goes out to the different, I know maybe step back a sec. I know our OC health department goes out to some of the manufacturers here and does safety tests for them, helps them identify their risks and things like that. And then do you get involved at that point?
Yeah, so again, if they have a threshold shift or a hearing loss that's just comes out of nowhere, then that's something that they would probably want a diagnostic evaluation performed on. So that's when I would get involved with it.
Okay, those are good things to know. And I think I want to go back again. We were talking about children and how that hearing loss is often, I don't know, just not noticed right away, or that there's things that we're not aware of as parents that our kids are doing. What about, well, we talked about wearing the buds in their ears all the time. Are there other things that our children are kind of apt to do that can lead to their hearing loss?
I would say there's not a whole lot, so which is a good thing. So aside from listening to loud noises and warding off any possible ear infections or likelihood for ear infections, there's not a whole lot that children are susceptible to that can cause a hearing loss. So that's good.
Yeah, it is good. That is good to know. But then what is it that causes, as we get older, what happens to our ears that makes it, so many of us lose our hearing? What happens?
So just like lots of the cells in our body degrade as we age, the cells in our ear are no different. So, so they just break down. Sometimes heredity has something to do with the hearing loss, or
if you had grandpa or
exactly, if your parents had hearing loss or grandparents. And those are the things that are probably the most common cause of hearing loss as we age. It's just a general breakdown of the cells, or having a family history, and then history of noise exposure. And sometimes people can be on medications that are poisonous to the ears that can cause a hearing loss, which most people are not on them. But like high dosages of Valium or painkillers can sometimes affect the hearing, and
that's interesting. Didn't know that.
Sometimes chemotherapy drugs may have an effect on the ears, and just certain medications like that. So it's just important for people to know what the side effects of their medications are, so that we can at least monitor if a hearing loss is going to be developing.
Sure. Now, I just thought of this as you were talking, how they, and I don't even talk about wives' tales, how if you eat more carrots, it's good for your vision. Is there dietary things or vitamin supplements that you could take that could help your hearing? Have you?
I don't know that there's any clinical research that supports that there's anything that you can do to preserve your hearing. Probably antioxidants are good for everything, so it couldn't hurt. Right. But I don't know of anything that you can do definitely to prevent hearing loss.
I was just curious if there was like good ear health.
Yeah, not that I know of. I wish.
Take 2 of these every day. But then you'd be out of business. So,
I probably would, or I could get in the business
something
of selling
different.
supplements.
There you go. So One other thing I just thought about, going back to our kids again, in the schools, they do screenings, I
Yes.
believe, at certain ages, is it? So what ages do they do that screening?
I'm not sure exactly what grades are screened, but I know that children are screened going into their kindergarten program.
Okay.
And then certain years, certain grades thereafter, they're rescreened. And then any child who is on an IEP, an individualized education plan, needs their hearing evaluated regularly, and vision as well. And then children who fail the screenings are referred to their doctor or for follow-up, so they can figure out what's
So that's a lot of
going
time they
on.
end up come to you.
Yes.
For those kind of checkups. So it's good to know that we've got those programs that are kind of helping, I guess, parents catch, be aware of those issues, because a lot of times we just think they're not listening to us specific, so it is good to know. Before we leave, I want to make sure everyone has your phone number again, so if they have questions, they can call you.
Sure. It's
Okay.
928-681-8717.
Super. Thank you. I really appreciate you being on the show today. Remember to wear your hearing protection. And I'm glad you joined us today too. Join us next week when I'll have another exciting guest on the program.